緑子を持つ母ならば、その健やかな成長を、それのみを願うことができる環境を日本は作りたいと念じます。日本では懐妊を知った女性は手帳をもらえます。母子の健康を長く記録するノートで、母子健康手帳といい、本制度は70年以上続いています。手帳は母の我が子よ、健やかなれと願う祈りの記録です。それは力を帯びる。この子に命を粗末にはさせずと母親に念じさせる力です。
Japan pioneered the concept of maternal and child health handbooks, MCH handbooks. These are notebooks recording health information of mother and child from pregnancy through birth and early childhood. In Japan today, the infant mortality rate is 0.19%, 1.9 per 1,000 live births, one of the lowest such rates in the world. A major factor in this achievement is the seamless monitoring and care received by mother and child from pregnancy through birth and child-rearing, facilitated by the committed use of MCH handbooks. The origin of Japan's MCH handbooks was a government-led pregnant mothers handbook system begun in 1942. The handbooks were distributed to expectant mothers to ensure they received priority access to resources during wartime scarcity and to encourage regular checkups. Great importance was placed on the health of pregnant women so as to minimize infant mortality. In August 1945, the Second World War ended for Japan, with most of its cities destroyed by air raids. The nation began rebuilding from the rubble. In the post-war chaos, many children perished from malnutrition and infectious disease. In 1948, the pregnant mother's handbooks were replaced by so-called maternal and child handbooks. The previous system had focused only on pregnancy and delivery. The new one expanded to include the infancy of the child, resulting in ongoing monitoring of health both before and after birth. Later, in 1966, the Maternal and Child Health Law was passed. This formalized the term Maternal and Child Health Handbook. The new law required more frequent health checkups and greater health-related guidance. By 2004, MCH handbooks were being used throughout Indonesia. This was achieved in about 10 years with assistance by JICA, the government agency that coordinates Japanese official development assistance. Palangkaraya, the capital of central Kalimantan, part of an island in Indonesia. The Kahayan River runs through the city. Villages along its banks hold traditional posyandu. Posyandu are a community-based healthcare service for pregnant women and infants. They're held once a month.
I came to check on how my child is growing. My kid is weighed at posyandu, so I can check that he's healthy.
Maternal and Child Health, or MCH, handbooks play a key role at posyandu. The book is a record of the health of both mother and child. It shows weight and vaccination reports. This is vital information to protect the lives of pregnant women and infants.
The Maternal and Child Health Handbook lets me keep track of my health and my baby's health.
Many developing countries still have high mortality rates among mothers during pregnancy and childbirth, and among newborns and infants. JICA has therefore been developing and introducing MCH handbooks in countries other than Indonesia too. The Philippines. The use of MCH handbooks is spreading here with the support of JICA. Jenny is 9 months pregnant. She has experienced 2 miscarriages, but using the instructions in the MCH handbook and with the help of a JICA-trained midwife, she has created a plan for her pregnancy and birth. Sometimes I don't know what I'm supposed to do. But I read the MCH handbook, and then I feel reassured. MCH handbooks have also been introduced in the conflict-torn state of Palestine in the Middle East and in Africa in Kenya and Cameroon to promote the health of expecting mothers and infants. The MCH handbook is a tool for monitoring the health of women and children that can make the difference between life and death. In this way, the use of MCH handbooks has spread to over 30 countries and regions throughout the world. As part of its international cooperation effort, JICA is committed to enhancing the health and welfare of mothers and children through widespread use of MCH handbooks.